Hey guys, welcome to your Fridays in your Max Allure week. I hope that you're having a good week. It's almost February, and it's gonna be time soon to start our new mastermind. So, yesterday I was talking to somebody. This was a physician, and I was really impressed by what they were telling me. They were really feeling confused, lost in medicine. What it would be, their future. They just don't know. They love to be a doctor. They say, you know what, the least stressful part of my day is being a physician. And they still cannot understand how they're in the position where they are right now. Hey guys, ahí viene Dr. Ortiz. Hey Dr. Ortiz, let's act proof of you coming in. Because telling a story about somebody that I talked to yesterday, and it was a physician.
How are you, Mika? You hear me? ¿Me escuchas?
Now?
Ahora te escucho.
Okay, perfect. Well, we'll take this. So I was telling, welcome, happy Friday. How are you?
Fine, thank you. And you?
Good, good. I was telling our audience about a doctor that I talked to yesterday, and that's why we have these efforts. And it's a doctor who really was feeling overwhelmed, lost, like they didn't know how it had happened that they were in this situation that they were right now, where as a physician they love being a doctor. They say that it's the least stressful part of their days that patient encounter, but yet they have so many hurdles and so many things that they have to deal in the daily basis that it's very difficult for them to understand and to foresee a future in medicine when the whole family is like in business and being in control of their lives. They really want to do something like that, and I like your point of view. And for those who don't know, we're going to go a little bit over Dr. Ortiz's background here in a second, being an executive physician and an entrepreneur as well. Uh, but it's, you bring a different point of view, not only the medicine in Puerto Rico, but also from and as an executive, the things that we have to comply with and commit to continue to have this career in medicine. So can you tell us a little bit of your background for those who have not listened yet to the podcast? And I hope that you guys go back and listen to the podcast, Design Your Physician Life. It was released on Tuesday. We have there his story and a lot of details about his career. So I invite you to do that and then do hashtag live, hashtag replay. And tell us a little bit about your background for those who don't know and they have just connected.
So thank you again for having me, and we had a blast in our podcast. I think it was very interesting to understand and go back to my story and your story and our story together as medical school students together in Puerto Rico. So my background is I'm a family physician. I come from a small town here in the island, Puerto Rico. It's called Comerío. uh, we discussed in our podcast that I enjoy seeing family physicians managing family. So that's a role model for me, and I decided to go through all, study biology, went through medical school. I ended up as a family physician, and having that reference of very good family physicians in my community helped me, understand the value of the family medicine and family physician in communities. We discussed in our podcast all the burden, all the problems that we're having in the island and that are common to the state also. But we also discussed the joy of providing services and serving our communities and our people, right? And that's the fun part of it. That's the important part of it. That we enjoy, that we have this commitment to provide services and take care of our people that are in need.
So it's, it, as I say, like most of us, we have in our groups, we have people who come, and even though they're overwhelmed, we really like to be a physician. That's a very important part. And in your case, you've transitioned to this executive position through the years, where you've helped hundreds of thousands of lives, as we call them, right, in medicine in Puerto Rico. Like, I don't know, I think like you've been in charge in for almost a third of the patients in the island at some point, which is, something very humbling, that your work has been able to influence so many patients and physicians and everybody across that healthcare system. So I want to ask you, because you talked a lot about these things in the podcast. So once again, you guys, if you haven't listened to it, go and listen to the podcast for details. Which things, you have a physician who is in this in feeling burnt out, right? And they're in a system that has evolved in ways that we really were not expecting and managing. Which tips can we give physicians who are navigating these systems to make it easier for them? Because we want them to remain, we want good doctors to take care of us, take care of our patients. Which tips would you give, understanding both sides of the coin, right? You're in the administrative side and then in the delivery of care side. Which tips would you give to physicians who feel like that
Yeah,
in Puerto Rico?
I think we discussed this, as you say in our podcast, and this is very important. Puerto Rico has a high penetration of managed care, and the sets of rules and requirements from the primary care physicians or the specialists in an environment like this that is so controlled, has so much penetration of managed care. It's important to understand the market, so you can provide services in an environment that support the patient navigation in the system. And it's easy for you to do business, to do billing and collection appropriately for your practice to be profitable, right? So there are things that you can do, but essentially you need to start understanding the way that the business is taking place in Puerto Rico in a managed care environment. Second, you need to surround yourself with people that are knowledgeable of the system in Puerto Rico and help you understand the process of getting credentialized, getting contracted as soon as possible by the health plan, navigate the system of billing and collection. And people with experience in your special field, people with experience managing the relation with the health plans or the payers. And also, you educate staff and providing good customer service within that market environment that requires so much from the medical practice. If you don't do that, you will have problems. And that's why we're seeing in many young graduates and people that have no experience. And then they have problems and they lose money and they lose opportunities in the first semester or the first year of their practice, because they are going to a system that is very complex, right? And you need help. You can do it alone because you don't have the background. This is not taught in the medical school. So you need people that are specialized in that part of the business and the operational side and the transactional side of the business. And you are getting in. You as a family physician, as a primary care physician, as a specialist, you're becoming a small business in the island. And you need support from people that understand the legal issues, the human resources issues, the financial issues, the transactional processes with the health plan for you to avoid denials and to make, um, get the reimbursement that you deserve as soon as possible. Those are recommendations, and there are organizations. We were not very specific in the podcast, but we can publish that in the podcast, and we will. There are organizations that can help you navigate the system very soon in your timetable, as soon as you graduate, or even before, to start your credentialing process, your contracting process, and as soon as you put together your job, right, your medical practice, you are ready to go. And we will talk about that in another week.
So, for everybody who's listening to this, when you're going to medicine, even if it's in Puerto Rico or here in the United States where I am, it's basically the mindset, right? You're going into a system and you have to understand that, yes, as physicians, we have learned all the medicine that we have to learn. Well, not all of it, but a lot of the medicine we have to learn from medical school and our residency and our fellowship to take care of that patient. But it's really, at the end of the day, there's going to be certain things that are going to be innate to that business. In Puerto Rico, most of the physicians are still taking care, being the doctor and being the business owner at the same time. Here in the United States, it's the other way, but there in Puerto Rico, most physicians are going to own their practices. And managed care has such, like almost everybody is a managed care. They tell you that they're Medicare. Very rarely they're going to be just straight Medicare with a supplement. It's going to be actually an alternate plan that is covering for Medicare patients. And in the island, that's a very culturally, it's a very different situation from here in the United States. So once you understand that that's the system that you're going to, you have just to get ready for that and then live it. And it's going to be evolving the same way it's evolving here. I want to get into a little bit of the differences that I see for patients who are there in the island through managed care, especially the people who are over 65, the way that they're handled, the things that they have as a patients, they have access to, and the mindset behind that, or the way of thinking behind that. Because I've heard from some, from my mom lives in the island and she has these plans. My parents, my families, they live there, and they have access to certain services that you would not expect from a normal insurance to provide. And you talked to me about this, and it's something that taking care of the patient as a whole. Can you tell me a little bit more about that, about certain services that you would really not expect a health insurance to do, but which the services are and why they're providing these services in the island?
Yeah, I think what you're talking about and your family members are talking about is that in Puerto Rico we have one of the highest penetration in the market of Medicare Advantage. We have around 82% of penetration of all the Medicare eligible patients are part of a Medicare Advantage in Puerto Rico. That's the highest penetration in the nation. Uh, the the attractive of Medicare Advantage products in Puerto Rico is exactly that. They provide additional service that for poor people, that people with disparities in the island, is very attractive to have benefits that cover the social determinants of health situation. For example, non-emergency transportation, access to for money for groceries, that covers the food insecurity, for example, and transportation, for example, it's been a great benefit in Puerto Rico. Non-emergency transportation takes you to the grocery store, takes you to the church, takes you to see your physicians in appointments, and transportation is a big issue in Puerto Rico. So dental, eyeglasses, hearing aids, and support in basic things in the house like electricity problems, plumbing problems. Those are things that you may see simple, but those are determinant of health that can impact the health, and also is a benefit that is very attractive for the patient. So
I have never seen that being covered here. Like somebody, your health insurance is going to cover plumbing in your house so that you have access to good water. And if you have access to good water, then your health is going to be better. And that has been identified by the same insurances that provide care here, but there in the island is way different.
yeah, and believe me, the penetration of Medicare Advantage in the States is also growing very fast because it's attractive for population that have difficulties in the social aspect of their lives. And we all know that the importance of, now we're understanding more and more the importance of those social determinants of health and the impact of the health of our patients. So that's the reason. And another problem that we mentioned in our podcast, right, is the reimbursement that the island gets as a jurisdiction compared to any other jurisdiction in the States. It's much more lower. We need that money from the federal government to improve the adequacy of care that we can provide in the island. We receive, in average, more than 40% less premium than any other the average premium in the States. And that's a disparity, that's a gap that we need to close in the island in discussion with the federal government, because that money may be reimbursed by the providers to provide quality of care to the patients, to get more technology in the hospital, for example, to get more access. And that circles back right to the patients. And we hope that in the future we close that gap. But again, it's very attractive. The patient gets the benefit of that, and we need to keep working that the right patient get the access to those benefits that the Medicare Advantage are offering in the island.
So, as a physician, you mentioned a very huge thing, because the patients are getting a lot of these benefits, but at the same time, the island has a huge lack of services, like in terms of physicians who have left because of all the hurdles, and then the that pay that pay difference when you move and take a plane and you start working on the mainland, then things are way different financially for that physician. And most physicians who are in the island, I'm guessing if it's still this way, it's like because family is in the island. You want to stay there with family and friends, and you want to service your island, and you're proud of doing that. So think about people who are listening to this and they say, why should I go to Puerto Rico? How could I make this work for me, where it's a win-win situation, where I go there and then I enjoy my friends, my family. I go back to service my communities there where I came from. What would be some tips that you can tell? Okay, here's an area for opportunity, right? For you to come here and serve this island, and even if you don't have roots in the island, that you can attract some other people. What sort of efforts have been made by the island or by the companies that you might know more than what the regular doctor would know about? Which sort of things can make it attractive for us to get more physicians working in the island?
Yeah. Well, first of all, let's go back a little bit of the root cause, what causes the limitation in offer. We have a population of a provider network that is aging, right? And many of them are retiring. We have board certified, very competent, bilingual students that go to the U.S. to get their specialty, and they develop their life there and they stay there. That's the reality. And the other thing is that we have limited opportunities here for training institutions or educational institutions in postgraduate degrees or specialties. First of all, we have a very nice network of very good hospitals that are joint commission certified, where you have peers that are double board certified practicing in Puerto Rico, and they have a good life as physicians, and they're providing services to the patients in the island. They are, as you say, in a beautiful place and with their families and their friends. So you have an ecosystem that is supportive of providing good care. There have been challenges, obviously, as in many jurisdictions in the state. It's not only in Puerto Rico, but in Puerto Rico, I think the opportunity is that the demand is there. You will put together a practice, and will have a patient baseline. You will have a patient population very fast. If you understand the system and if you get the right partners in billing and collections and supporting you in the administrative part of the business, you will do good, very good in Puerto Rico, and that's a reality. Obviously, if you don't do those steps, you will have problems because there are many challenges in the environment of managed care that if you are not knowledgeable and you are not managing that right, you will have billing collection, entering in different networks from different payers. All those challenges will be there, and you may have financial problems if you don't correct that fast enough. But again, I think it's a beautiful place to practice. It's a beautiful island. It's the Caribbean. All those add-ons, right? But again, you have a very nice ecosystem in Puerto Rico to provide services.
Well, and you provide, a really important point of view, being an executive, taking care of so many lives, as we said in the past, and you've seen how people will really have access, and we know that people will have access, like as a physician, they will have access to a population like almost immediately because there is so much need. I want to move on to something very important for you, to your heart, and here we have the opportunity in this medium to see what's behind you. Can you tell us a little bit about that? On the wall?
Well, I also enjoy painting. I'm a painter. I enjoy my favorite medium is acrylics and oil. And behind me is one of my paintings that is it's actually from a scene in the States. These are birch tree. It's a Let me show you.
It's beautiful. It's huge.
It's huge. It's in my house, in the corner that I'm taking this Facebook Live with you. And yeah, that's part of my, the way that we use as physicians. Some do, uh, some physicians do sports, some physicians do music. I do art and painting, and I enjoy that because that takes me to another environment, and I can relax with that. But I also dedicate a lot of time. I study formally painting. Every day I study. I have teachers, I have coaches, and I dedicate a lot of time. This is serious for me.
So tell us, do you have an exhibition coming up this
I
year?
I think so. I'm working on a new series. I had my first solo exhibition last year in December, mostly of landscapes and trees. That's my passion. And I think I will have, at the end of this year, another exhibition. Yeah.
Well, guys, you guys who are here, thank you for being here. Remember, hashtag live, hashtag replay. I want to tell you that listen to Dr. Eddie Ortiz's story. He became a physician out of passion, and out of passion, he's also helped so many other lives, and he's been able to be in control. He's designed his physician life to be able to provide direct care to patients, to do a great, have a great career as an executive physician, providing care for so many lives in the island, and being a painter as well. And he doesn't consider himself just a doctor who paints. He considers himself a painter, and he puts the time and the effort to learn and to bring that other part of himself, out to the community. So thank you for being here. Is there anything else that you want to mention before we disconnect here, that you want to share with our listeners, with our viewers?
Um, First, thank you for the opportunity to be part of your podcast. I think you deserve the success because you also dedicate a lot of effort and passion to this podcast and the things that you're doing. And I want to speak in Spanish a little bit. Gracias a todos los que nos están conectando. Sigan el podcast de Mildalis y que todo, yo creo que tenemos retos en Puerto Rico, pero tenemos oportunidades y lo más hermoso que hay, ¿verdad? Que es servir a nuestras poblaciones y a nuestra comunidad. Así que, thank you again, Miguelis, and Have a nice weekend.
Thank you for being here. And for those who are paying attention to this, February 1st, Wednesday, February 1st, is our first day of our next session of our mastermind. We don't take more than 10 people. We still have some spots open. So you can visit our website, maxsalure.com, maxallure.com. And then just get a session with me, a discovery session. And what happens during the discovery session? We'll talk. I get to meet you, you get to meet me, and then we see if this is a program for you, which is basically for those who really feel overwhelmed, lost in medicine, who want to know what things they can do to really take back control of their lives. And then the podcast is called Design Your Physician Life. You'll be able to listen to this last week's wonderful episode with Dr. Ortiz. And thank you for being here. Thanks for the opportunity from the bottom of my heart. I remember, we went to medical school together, and I would have never imagined in a million years that we would be here talking in these positions that we are right now. So I'm very thankful for the career that we've had, for the friendship, for all what you've done. So gracias por todo. De verdad que ha sido un honor increíble tenerte aquí. Gracias por tu amistad y por todo lo que haces por todos los pacientes en Puerto Rico y por los médicos, porque tú los ayudas muchísimo a ellos para que puedan hacer su labor a diario.
Emociono y todo. Thank you.
Bye. Thank you, everybody. Have a great weekend. Bye. See you next week. See you Monday.
Thank you.